Kuphina kuphe emakhaya amadolobheni aseComplas takhona lapho bukela khona SABC 1. A warm welcome to this week's installment of Yilungelo Lakho It's Your Right. Uhlelo lokuthela ke konke lokuthinga wena nemalungelo akho njengemthengi lapha eNingizimu Afrika. Namhla ke bekunene sitawubuka budlapha lobuyayibendeke ke uma uthola lusitho emtholampilo kanye nemalungelo akho njengemuntu lonesidingo thide. Bese ke kutholakala ukuthi kukhona lokungakahambi kahle kwabodokotela ekliniki noma ke esibhedlela. Asisingene endzabeni yethu namhla. Asocabange nje uya emtholampilo uyofuna usizo nabakwelapha kungahambi kahle bese ke leso siphosiso noma ke budlapha babodokotela noma ke emanesi sikukhinyabede impilo yakho uze uyongena emgodzini. Athine ke malungelo akho kulolu hlangothi. Asesive na indzaba ke emntali yemfana lotalwe akhubatekile ngendaba yekunganake kwemanesi noma kubodokotela kulesi sibhedlela lapha eJozi. Asesive indzaba yakhe.
Try to I'm skipping to 3.
Don't skip, let's try 2.
2 doesn't hurt.
I believe ukuthi if bebenza ngendlela right ngaba abantwana bami basaphila bobabini. Futhi I believe ukuthi ngabe nalo ophilayo akanayo ile situation akanayo.
Abo abatyholayo nathi zange babe noyo ngabongikazi nogqirha kwesinye sezibhedlele ezidumileyo eGauteng. Lo mzali utyhola ngelithi selekhulisa umntwana okhubazekileyo nje yimpatho gadalala kwisibhedlele awabelekela kuso. Kwiminyaka eli12 edlulileyo okamvelase wafumanisa ukuba ukhulelwe amawele ndaba ezo ezadala uchulumanco kuye. Kwathi kanti olochulumanco liza kuba lelexeshana.
Wabhala nge-red pen ukuthi should ngibe nama labor pains agent to theatre. Wabhala ekhadini phezulu. According to the doctor wathi bathi ababonanga. Because udoctor naye ufanda uthe maseke ngisa kwi-scan mase ngimchazela ngithi I know mayethi kim pregnant ama twins and ba ama bridge ngathi I know nasekhadini kubhaliwe.
Okamvelase ukholelwa ukuba ukungafundwa kwelo khadi ngogqirha nabongikazi kwisibhedlele eso awayebelekela kuso ngunobangela wokukhubazeka komntwana wakhe namhlanje. Seso skanike esabonisa ukuba elinye lamawele alisekho emhlabeni. Wakhutshwa esibhedlele nomntwana omnye nekwathiwa uphile qethe akanakwa sikhwasilima.
Yonke into kwathiwa i-right mina into engiyaziyo nje ayikho into eyayibhalwe ekhadini wrong. Uthema kaqala ukukhasa that's when sasitshela ukuthi lazy yabo because bekakhasa ngenyawo eli1 sithi hayi lo mntwana ulazy. Makaqala ukuhamba bekahamba nge-upper part of the foot.
Sithe sakumongamela isimo somntwana wakhe lo mzali wabuyela esibhedlele efuna impendulo kwanoncedo. Wehle esonyuka ke equqa kogqirha efuna ingcaciso evakalayo yowona nobangela wokukhubazeka komntwana.
Ngike ngamnikeza nase ngithi ngifuna bamfake ku-MRI scan nami ngibone ngizidelele ukuthi yini inkinga yakhe kwenziwa yini. Ngichazela ukuthi waluza i-oxygen during birth. Phinde ukuthi the other twin lelo lishonile lalihleli phezu kwakhe so akusiya amathambo imthambo le eyenza ukuthi kube so.
Ukanti ingxelo zempatho gadalala yezigulane ayondwintsha yaye oko zindleko ezidla engxoweni yamaziko ezempilo. Kuqikelelwa ukuba malunga nesiqingatha samabango okungakhathali kwezonyango ngakurhulumente womzantsi Afrika ngamabango ohlobo oluchaphazela ingqondo naquka impazamo kwezotyando. Uphando lukwabonisa ukuba inani elandayo lelentsana ezisandula kuzalwa zezishiyeke zikhubazekile ngokusisigxina ngenxa yeempazamo ezinokuthinteleka kwaneengxelo zokuxhatshazwa kwezigulane.
I don't want to talk about what happened, but bekungamnandanga. Besishaywa laphayana.
Ingaba sithiwa nina isimo esinjalo? Khona uqala ngaphi ukufaka ibango xa uthe wazifumana ulixhoba lempatho gadalala okanye iimpazamo ebezinokuthinteleka kwiziko lezempilo? Phaphama Changana Dube, Yilungelo Lakho.
Buto lomhle kakhulu ke lowo ke Makhumalo siyabonga kakhulu ke kuleyo insert. Vele simo lesinjena ke sithiwani. Athine amalungelo akho njengesigulane. Kukhuluma kabanti ke asesimukele ke Zuko Mtlomelo lovela ke e-DSC attorneys phindze sibe na Dr. Angelique Coetzee lomele ke i-South African Institute of Medicolegal Experts. A very good afternoon to you too. Thank you so much for joining us. Welcome.
Good afternoon and a warm welcome to all your viewers and listeners out there.
Thank you so much. It's an absolute pleasure having both of you join us in this very, very pertinent conversation. I'm going to start with you, Zuko. Kutsike utsini ke ngale insert lesiqasa kuyiva nyalo. Nekutsike atsini amalungelo esigulane noma ngabe ngibani lo le emtholampilo awuthi uthola usizo kwatfolakala ukuthi indva sahambi kahle.
Well, manibulele ithuba mhlakazi na. Maniqale ngokuthi usisiphaphama lo i-report uyicacisile first and foremost nokuba umuntu xa pregnant sube lonto leyo ibonisa ukuba ngabana umntana lo intsikelele kuvela kuThixo.
Yes.
So now kufike ngoku ixesha loba lo mntana ebeyintsikele angaphumi ngendlela efanelekileyo ngenxa yobugwenxa ke kubantu bezempilo. Loo nto ithi iphele ngoku itshintsha ubomi bomntana. So into edibanise namalungelo omzali nomntana ngokomthetho we-Constitution yoMzantsi Afrika kuthiwa akukho mntu ekumele into yokuba ngabana avinjwe uncedo lwezempilo olufanelekileyo nolusemgangathweni. Istory sikasisi esi siyacacisa nje ngokupheleleyo into yokuba ngabana kukhona ubugwenxa ekutheni kuhandlishwe i-pregnancy yakhe because xa usibuza uzawuthi bekutheni ze inote le kagqirha ibichaza uba ngabana ukuba kufikelele ixesha elithile kufuneka kwenziwe esiphi isenzo ukwenzela uba kwenziwe sure i-pregnancy ihamba kahle. So ubugwenxa ke obo bubuthe benza into yokuba ngabana ekugqibeleni kufumaniseka ukuba omnye umntana ophuma sekeswelekile, omnye umntana uphuma sengaphilanga ngokusempilweni. So ilungelo ke lo mntu ozifumana kwisimo esinjalo kukuba kuqala adibane negqwetha eliyingcaphephe kwizinto ezidibanise nokulimala kwabantu engakumbi esibhedlela. Ibe ligqwetha ke elizawuthi based on i-experience leyo likwazi uba ngabana lim-advise into yokuba ngabana based on isenzo eso esithe senza ukuba ngabana kubekho umonzakalo emntwini okanye emntaneni ingabe likhona ubango olunelithi lifakwe either against isibhedlele okanye against umongi leyo okanye ugqirha lowo if mhlambi it's a private doctor okanye it's a private nurse, but if mhlambi sisibhedlele sikarhulumente then ibango lingafakwa against ke urhulumente isebele lakwa health.
Mr. Mtlomelo. Let's also bring you in this conversation, Dr. Coetzee. Basically, in a nutshell, a parent was pregnant with twins, and then one of the children, one of the twins, well, it was a stillbirth, and then the other one managed to survive. But as time went by, there was a bit of abnormality in the other surviving twin. And during the birth, there was so much negligence on the part of the nurses at this hospital that we will not mention, at least at this point. So what is the parent's justice? What are her rights in this particular instance?
Thank you for asking. First of all, what I heard is the term breach was used, and if you are having twins with one confirmed breach baby after 36 weeks, then normally you would schedule a cesarean section and don't let the mother with a breach and another if it's a twin where one is a breech, you will normally not let them go into spontaneous labor. So that doesn't really make sense. Why didn't they, that would be my first question. Why didn't they schedule a proper cesarean section, seeing that one was a breech? However, if both were normal vertex deliveries, you could have gone, and help the mother to go into labor, but it should be, again, controlled circumstances. So if you then go into labor, and it's a twin, where one is a breech, as I've said, cesarean section should be the obvious option, what we will normally do in the private sector. If you can't do a cesarean section at that stage, in that time of the moment, you have to monitor that both of the twins with a cardiotachograph, make sure that there's enough oxygen, that the mother is not in distress, the babies are not in distress, and then you need to organize a theater. If you don't do that and the babies are in distress and one is a breech, then like not actually, it's not good practice to allow her to go spontaneously in labor, as the babies might suffer lack of oxygen with then cerebral palsy or anything afterwards, due to whatever went wrong. So that's where, but my first question would have been, why, if one is a breech, was it not a planned cesarean section?
So, Dr. Coetzee, what's the difference between medical malpractice and medical negligence? Is there a fine line between the two? And this particular incident, where would you classify it under?
So, yes, there's a difference between the two. So, in this specific case, this can go under negligence, because the protocols, what is the protocol of the hospital? What is the protocol regarding twin births? Are the hospital equipped? Are there a good facility for infants, especially neonates? Because we know that with a twin, you most probably go earlier into labor than with one pregnancy. So then again, were the personnel, did they follow the correct guidelines again? Was there a doctor? When did they call the doctor? When was it decided? What was the clinical notes? How good were the notes? Yes. And was it clear to the mother that, was it the conversation between the doctor who actually followed up the mother? Was it clear that if I'm not there, there's a breach, you need to go into, you need to look at the cesarean section. But again, it all depends on what happened. But it seems like I don't have all the facts, but for now, it seems that there was, the protocols was most probably not followed the correct way. But you need more of the facts. And then again, I think the mother have a case to go back and say, listen, right from the beginning, one is a breach, it's a twin, what is the protocol of the hospital?
I suppose that is that's the gist of the matter. Apparently, the nurses at the hospital which she gave birth did not follow those clinical notes that was given by the doctor. But thank you so much, Dr. Coetzee, for putting it out there. We'll now take a quick break. We'll be right back. Please do join us after this break. Sakumela futhi ke mbukeli icingo tethu sesivuliwe ukuthi nawe ungaba ingcenye yalo nkulumo yethu ungasishayela icingo ku 011-714-0669 noma ke 011-714-0670 ungasithumela futhi na-email ku consumer@sabc.co.za or alternatively ungaphinza usilandzele futhi ku Facebook na ku Twitter. Namhla ke mbukeli sikhuluma ke nganakulaba bakufunzile ke i-medical negligence noma ke i-medical malpractice kuthi nangaba emtholampilo uyothola lusito tside bese ke akusahambi kahle lokho ke bese sekukhwinyabeta ke impilo yakho uze uyongena emgodzini kuthi ke namhla sikhuluma ngekuthi athini emalungelo akho kulelo hlangothi. Let's take our first caller. Sina Patosi ulapha ke Gqeberha sakumule ehleleni sawubona.
Hello Dade.
Baba kunjani?
Ndirathi Dade ndiyabulela tata njani yena?
Hayi siyaphila kakhulu baba. Khuluma nathi baba, what's on your mind?
Ukhuluma no Mr. Patosi on the line from Gqeberha. Yes.
Thank you so much. What's on your mind?
Yes, tata wam ndiyavuka bandikhalaza kakuhle kodwa ndibone ndinomdla kwelento ifakela ngelungelo. Uthi nam engathi ndiyabandakanyeka malunga nenkosikazi yam eyasweleka ngo-2018 apha eTierra Letitia Bam eday ongakwazi ukuchama ndamsa immediately esikumani chami ndamsa ke ngokutata ndabe ndimsile bathi ko-onesi babekho no makavulela amanzi etepini uzawuchama makagoduke akho nto abazamnika yona makawuvulela amanzi etepini xa ndimvuka efika apha endlini evula amanzi etepini akachami ndamphindisa ngomso ndamsa eLetitia Bam again ukuba makaphinde ndiyokhalaza ukuthi awazechami but ayayikho enye into abalonayenza because benovulela amanzi achame sozangachami kokuvela ngokuhla xa elala njengomuntu ongachamiyo wadumba wasweleka. Mna ndandi-expecte mhlawumbi ukuthi xa ukwenza njengabanye abantu endla ngobabona befakwa i-cartage xa umuntu engachamiyo.
Okay, Patosi siyabonga kakhulu ukusishayela. We've got a legal expert there to help you with that. Mtlomelo ngiyathemba ukuthi uzivile kwesikhalo saba Patosi lapha ukuthi ngingamphendula umthini.
Well, ndimvile bana niva kahle nikho shona bebengasondalanga emakhini but i-gist of history sakhe nisivile mhlakazi wami.
Yeah.
So kwisimo esinje i-case zobugwenxa bezempilo ndifuna uyibeka ngolu hlobo mhlakazi. Lusebenza ngolu hlobo. Xa kuthe kwafumaniseka uba umntu uthe ekuphathweni kwakhe eyocela amancedo ke for impilo yakhe kwenzeka uba alimala. Sometimes abanye abantu basweleke. Ukuze thina sazi nje abagqwetha ukuba ngabana umzekelo kule case kabhuti ukuba ubhuti une-case okanye akana-case okanye mhlawumbi abantwana bakhe abakhoyo abasaphilayo emveni kokusweleka kumama uba bane-case for i-loss of support. Siye sixhomekeke kwi-medical experts eziye zithi zibhale i-report based on i-information ekhoyo such as i-clinical notes ukusukela ngeli xesha beadmithwe esibhedlele kwiindawo ezithile azihambileyo for uncedo kuyothi gaga ekuswelekeni kwakhe. Ziye zisichazele ke ngoku ukuba ingaba indlela le usisi aphatheke ngayo kusukela ekuqaleni yotsho kwixesha lesiganeko ingabe biyindlela le esemgangathweni kuba oogqirha nabongikazi banendlela abayibekelweyo eyokuba ngabana benze ngayo ngalamarhumsha ke kuthiwa si-standard of care. So ufuneke bona xa besenza izinto bazenze ngempatho epheleleyo. Uba kuyenzeka ke kubonakala uba indlela le i-patient ethe yaphathwa ngayo iphatheke ngempatho engaphantsi kwale kulindelekileyo kumongikazi okanye kugqirha, loo nto le ethi ikhokhelele into yokuba ngabana kulimale umntu. Kulapho ke ngoku kuye kubonakala uba zikhona ii-grounds zoba mhlawumbi kungaklenywa against ke either isebe lezempilo okanye ibingu-private doctor kuklenya against udoctor leyo ngokenxa yosenzo sakhe. So kwicase enje kukumila kanje kubhuti because i-medical malpractice cases they are very complex in their nature. So kuye kudingeke mhlawumbi kuthiwa kuhlalwe phantsi kuconsideration effects ze-case yonke. From there on xa sesibona ukuthi mhlawumbi there's a potential claim simreferishe kwi-experts zisinike loo report, then singakwazi uba ngebona si-decide uba ikhona iclaim okanye ayikho.
Okay, siyabonga kakhulu for raising that point. Dr. Coetzee, we've just had a caller there from Gqeberha who says that her wife passed away in 2018 as a result of medical malpractice or medical negligence. So just picking up on that question, does a patient have the right to question a medical procedure before surgery?
Yes, for sure. So what actually needs to be done, the standard procedure, especially in the public sector and as well in the private sector, is that before any procedure, you need to sign informed consent. It means that the doctor who is going to do the operation needs to explain to you what is the reason for the operation, what are the side effects, what can you expect that can go wrong. So you need to be fully informed, and we call it informed consent. And in 2018, there should have been informed consent. So there's no such a thing that you can only say to a patient, listen, go to the hospital, we're going to operate you, and that's it. You can't do that. You have to say, going to operate you. And the difference is here, you asked me about medical negligence. So to make it easy and understandable is to, when my actions or my non-actions fail to meet the medical standard of care, and by failing to meet that, so that is medical negligence. But then if that fails because of my inactivity or my inactions, then that patient then suffer an injury because of what I have done, then it becomes medical malpractice.
Now, we're still hearing of botched surgeries. Does it mean that medical professionals need further training? How are we as consumer, or rather as consumers of medical services, supposed to be at ease in theatres?
That's a very difficult question, but it's a valid question. So I'm always advising my patients, you need to know the specialist that you are being sent to or referred to. You need to make sure, ask your friends, ask other doctors, if I won't send my family to you, why should I send my patient to you?
Right.
So it is difficult, especially in the public sector. And, sometimes people do operations that don't always have all their experience, or they think what they are doing is the right thing. And then it wasn't the right thing.
Okay. Thanks for raising that point there, Dr. Coetzee. Let's take our first caller. Sinavusi lapha Orange Farm. Segumukele ehlelweni sawubona.
Yebo sanibona.
Siyaphila kunjani baba?
Phila ngaphila baba.
Khuluma nathi baba. What's on your mind?
Nami ngingaba nenkinga la enyangeni eziwu2 noma 3 eqeda kudlula. Lapha eclinic yangakithi.
Yes.
So kusho ukuthi ngahambisa ingane eclinic ku-emergency.
Okay.
Mengihambisa ingane eclinic ku-emergency ukuthi izolo kwakhona bengiyise ku-private clinic. Bafike bayijova ku-private clinic base bethi ngibuye mengabe akabi right. Inkinga yakho bephethe. So ebusuku zange lesilala ngoba kusebusuku iclinic yangakithi ine emergency. Ngathi no, ithi ngimthathe ngemoto ngimise ku-emergency ngoba sekawese. Yebo. Sabona.
Okay, silalele baba.
Yebo, okay, mesisuka lapho mengimisa ku-emergency, siye ku-emergency bamxoxe bathi cha, nika amaphanado. Base bethi no, akalinde kuvulwe ngale eclinic enkulu ngabo 7. Okay, ngithi ngisaphuma naye bamnike amaphanado awe. Athi mayiwela phansi base bethi no, hayi sekuyi-emergency, bamthathe bamfake lapha phakathi ku-emergency futhi. Sebathi hayi bazomsebenza ngayo. Mabe sasebenza ngayo eze nomjovo. Mayeza nomjovo bese ngimtshela udoctor ukuthi no, izolo bekaye ku-private clinic bamjova. So ngicela ukukunika le file aphuma nalo lapha e-private clinic ubone ukuthi
bamfishane baba ngoba isikhathi asinaso ukuthi ke sichazele just briefly babe ukuthi kwendekani emva kwalokho ngoba ke isikhathi asinaso.
Ngicela ukuthi cha umjovo nje ukuthi akalale elinde i-ambulance uzothunyelwa eBhara. Engakamtshela.
Babe vuthi sicela ukuthi ube mfisha ngoba isikhathi asinaso unfortunately. Sicela nje ukuthi usithi fahla ngenzaba ukuthi kwendekani nekuthi ke umntwana wagcine ento enjani.
Udoctor wagcina umjovo engalicheckanga ifile. Wathi mayimjove engalichecka ifile umntwana waseba wese. Ngize naye umntwana ngiqoqa naye sikhuluma mesifike eclinic. Kodwa waseba wese umntwana engasakwazi ukukhuluma engasengathi manje uselahlekelwe umqondo kaso. Wagcina shonela khona lapho.
Okay, kusho kahle kahle bake bamnaka abanga check ilfile lakhe in short. Okay, Babe Vusi, thank you so much for your time. Okay, siyabonga kakhulu ke. Bukele, let's take another break. We'll be right back. Lele ke Yilungelo Lakho. Welcome back. Namhla ke sikhuluma ke ngemalungelo akho njengemthengi ke wetidzingo tempilo. Uthini ke uma utfola ke kunokungaphatheki kahle ke noma ke kulimala lokwenteka ngesikhathi utfola tidzingo esibhedlela noma ke ekliniki kwabodokotela. Ingabe ke lokho ke ungakuthatha ukumikisa kuphi noma ke lenzaba yakho ungayisa kuphi, ungaphinza wente njani? Sishaya lecingo ke ku 011-714-0669 noma ke 011-714-0670. And before that break, we had a call from Babe Vusi from Orange Farm. Uthi yena ke waqala wamikisa umntwana ke esibhedlela private hospital bamjova, and then waphinza wamikisa ke e government hospital baphinza bamjova ke e government hospital kanzi abakalibuki le file lakhe lase private hospital lokwendeka ukuthi ke bamjova ngemijovo lemibili. So I want to know from both experts, the medical and the legal experts who are joining us this afternoon, ukuthi ke yini ke malungelo aBabe Vusi next ke yini ke lengakwenda. Dr. Coetzee, I'm going to start with you and I'm going to pose the question to both of you. Before the break, we had a caller from Orange Farm who says that he took his child to a private hospital. He got an injection, and then he took the same child to a government hospital, and they gave him another injection without having checked this file, and only to find that he got 2 different injections leading to the child's death, and may his soul rest in peace. So what could have possibly gone wrong here? So can the parent sue the medical, the medical experts, the individual medical experts, or the hospital?
Sure, this is a difficult question because, we don't have all the background, the medical background, but it is imperative that if you take your child to any emergency, and it's not a life-threatening situation, consent needs to be given if there's an operation or whatever, but that's a procedure that needs to be done. So then you need consent. And if you can't, if it's a life-threatening condition, then and you're not being able to give consent for various reasons, they will then carry on with the procedure or whatever need to be done, because that is based on the premise that a reasonable person would not want to be denied necessary medical care because he or she happened to be too incapacitated to consent to the treatment. But in this specific case, with the young child getting an injection, it is extremely important that the child at both facilities must have been examined. There must have been some feedback to the parents, telling the parents, I'm giving you your child an injection because your child's got a asthmatic or whatever the reason. I'm not sure why you would give an injection to a young child. There's not a lot of reasons, except if the child was vomiting and again, but then the child is sick. But it doesn't sound like this in this case. So there's a lack of communication. For me, lack of communication. No one communicated to the father, telling him what is wrong with the child. Why am I giving you your child an injection? Therefore, the parents felt that not enough was done for this child, still worried about their child and took him to another facility. And again, no one actually, it doesn't seem to me that there was good communication. And this is one of the problems why we are seeing a lot of medical legal cases, because of lack of interaction between the doctor, the patient, and in the case of a child, the parents. You have to tell them, if I don't know what's wrong with your child, and your child is sick, I will say, I don't know, but let's admit the child. But apparently, if I listen to the father, the child was not okay. A father will not go from one hospital to another if they were satisfied with the treatment or the answers that they got. So here, I think there is a problem.
Thank you so much for that, Dr. Coetzee. Let's take another caller. We've got Prudence ulapha ke Soweto. Sakumbulo enhleleni sawubona.
Sabona njani bo?
Siyaphila kunjani ma?
Ngiyaphila.
Khuluma nathi.
Nginombuzo la. In 2004. ngabeletha umntwana ngaye ebhara.
Okay.
And then nangifika ebhara, I don't know what really happened because of I was out of something. I don't know if it was ngami. But waking up lapho, I found myself in high care khona lapha ebhara. Then bangitshela ukuthi mina umntwana ongifana, but asebenzise i-forceps. So makunjalo umntwana wahlala isikhathanyana 2 months to 3 months asesebhara, ngihamba mina ebusuku ekuseni ngibuya ngilengeza. At some point I find umntwana ICU, some point ema-warding. So it was just complicated. Ukuhambeni kwesikhathi umntwana makangena isikolo, I found out ukuthi esikoleni bayangibiza and they asked me inkinga ngomntwana. I said no, umntwana u-right from birth. Only to find out ukuthi umntwana he can read and write until the stage. Esikoleni they referred me to neurodevelopment ebhara. That was 2015. Mangifika lapho udokotela yasibhalela lapho ukuthi umntwana une-severe brain damage because of nomntwana ona-15 okwamanje he can't still write and read.
So make ufila ngathi le brain damage yendeka at birth as a result of negligence abodokotela nakatalwa?
Yes, I think it happened kanjalo because of the very same doctor umdeclare ukuthi une-severe brain damage. Mangitshela leso story, like you could tell ukuthi akavumi. As much as umntwana uphume nge-forceps, izinto lezinto lezi possible ukuthi lo mntwana bamlimazile i-brain. And bengifile ukuthi if bekunenye indlela ukuthi umntwana abe khona, i-first one angayithola ngisiza. So they would have made use.
Okay.
So
My Prudence, I think we've got the gist of the story. At least says it for you will get assistance in terms of advice from a medical and legal experts who are joining us on the show. Dr. Prudence, Dr. Coetzee, I beg your pardon, I'm going to pose that question to you again. We have a caller here, Prudence from Soweto. She says that in 2004, she gave birth to her son. And then she was admitted for 3 months in hospital. And then there was that back and forth, trips to the hospital. And when he was 15, he was only diagnosed with brain damage. And it only occurred to her that the brain damage occurred as a result of the negligence of doctors and the nurses who administered the birth. So she raises a totally different dimension here, which is equally important to this conversation with regards to brain damage and how long can doctors diagnose brain damage, and what should the recourse be for the parent and the child in this particular instance?
First of all, she needs to get the medical records. Now, if I heard she used the name Baragwana, so I presume that was the public sector hospital. So this is the first problem. The first problem is the medical records to obtain there, because that is going to help her a lot to see what went wrong, if there were proper notes. The second thing is every doctor or facility that look after, children, even if the child has been born in a specific hospital, the pediatrician or the doctor with that delivery, you are supposed to keep that notes for more than 20 years. Okay. That case is actually never closes. So even if the child is 15 years of age and then they decided, maybe the brain damage was due to something that happened when the baby was born, she still has a case to make. And that is one of the reasons in the private sector, the obstetricians doesn't want to do labor anymore because of their high premies for mal-insurance practice, because it's extremely high, because they need to put monies away for in case the specialist or the gynecologist later years get sued for something that went wrong during the birth of the child. So there's no such a thing that to say that the case is closed. No, the case is not closed.
All right, thank you so much, Dr. Coetzee. Let's take another break. We'll be right back. Yilungelo Lakho siyabuya khona manje. Samukela mfuthi ngimbukelisi sathatha ke incingo takho khona manje ku 0117140669 noma ke 0117140670. These are numbers on your screens right now. Pick up that phone and call us. Ungasithumela futhi nenombolo takho nge-email ku consumer@sabc.co.za. Satfolakala futhi ku Facebook na ku Twitter. Namhla ke sina Dr. Coetzee kanye ke na Zuko Mtlomelo. Now Zuko, we had two callers before that break. Earlier on we had a caller Vusi uthi yena ke wamixa umntwana wakhe esibhedlela a private hospital bamnika injection waphinze ke he wasn't happy with the progress, so wabise ummikisa a government hospital bamnika lomunye umjovo only to find ukuthi lo mjovo lo is in conflict with lo mjovo lebamnike a private hospital, because lapha ka government kahulumende abazange balichecka leli file lakhe lase private hospital, leading to the child's death. We also had Prudence ulapha ke Soweto uthi yena ke watala wabeleka nga 2004 and umntwana wakhe ke bekunema problems nje growing up and over the years, only to be diagnosed with brain damage sekana 15. Uthi ke yinde kangakwenda lokho ngoba ke uyathi ukuthi le brain damage yendeka at birth as a result of negligence yabodokotela. Uthi ke yini amalungelo akhe, what could the recourse be?
Okay, inkosi kakhulu ke bhuti. Masiqale ngoVusi. Lo mphulaphula befonile mayelana nomntana othe wafumana umjovo conflictayo. Well, icacile wena bhuti wami, icaca kakuhle mhlophe into yokuba ngabana ubugwenxa bukhona. Ndizawuthi kwelicala nangona ndingenazo zonke ii-facts nje. Oqala umongi okanye umongikazi, especially xa kukho i-clinical note echaza into yokuba ngabana zeziphi izinto kufaneleke zenziwe kwisigulana ezo ukwenzela uba lo mntu afumane impilo pheleleyo. So xa bezamfaka isijovo umntana, first and foremost babe bengamchazelanga utata into yokuba ngabana esi sijovo sisifakela ntoni, because okokuqala kufuneka babe yamcacisela utata uba esi sijovo sisifakela ntoni kwaye zeziphi implications ezikhoyo ezinothi zifumaneke nxa esi sijovo, so that kube khona laa nto ekuthiwa yi-informed consent, imvume enolwazi, so that notata lokuthi kubheka phambili abe seke sazi uba umntana ufakwe isijovo njengotata yakhe ke since umntana esemncinci i-consent ifuneka ifunyanwe kutata lo. Xa into ezinjalo ke zithi zingalandeleki, loo nto ibonisa nje ubugwenxa obucacileyo kwicala lomongi okanye ugqirha lo. So amalungelo katata ke njengotata umntana, utata uyakwazi uba aclaim okanye afake ibango. But now into endinothi itrick apha kule case asiqinisekanga okanye asinalwazi into yokuba ngabana oyena mjovo uthe wenza umonakalo emntaneni kulaa mjovo wokuqala we-private hospital okanye private doctor okanye umjovo wesibini lo we-public hospital. So ibuyele kulaa nto bendiyitsho ke kwii-cases ezinje iye ibe yi-medical expert based on i-experience ye-expert leyo ne-clinical notes ithi ke ngokikowe through zona ibone into yokuba ngabana umonakalo obuphi eqaleni kujonga uba umntana loyo yintoni ebebangela uba admithwe the-first place esibhedlele. Engabe ke ngoku i-treatment le i-administrashiweyo kuye yi-treatment ebekufanele uba i-administration kuye umntana lo. Ukuba mhlawumbi kuyajonga uba if mhlawumbi lo mntu lo ebefumene enye treatment ingabe ngebe usaphila nawo okanye ngebe usaphile nawo, okanye in any case if lo mntu ebehlele efumene le treatment ii-complications bezihleli mhlawumbi zikhona ii-chances yoba kungenzeka oku noku noku. Iba yi-medical expert ke ethi isinikeze loo report esitsho sibone ulwazi oluphangaleleyo. Na ii-rights zakhe kukuba since iyicase yomntana yena ungutata omntana kulilungelo lakhe yena njengotata omntana okokuqala ukuba ngabana adibane namagqwetha. Because okokuqala kukhona ixesha elibekelweyo apho abantu banothi bafake ibango. So once ke ukwaziyo into yokuba ngabana it's either a claim against the state okanye it's a private hospital okanye private doctor, kunamaxesha abekiweyo okuthiwa ungafaka kulo bango. So umzekelo if it's a claim against the private hospital from i-date of isenzo esesithe senza umntana abe uphulukana nomphefumlo. Kuba khona ixesha elibekiweyo, ixesha leminyaka emithathu apho kunothi umuntu afake ibango. But since ke ngoku sidilisana necase yomntana, umntana naye unexesha lakhe alibekelweyo lokuba ngabana angaziclaimela if uziclaimela in his or her own personal capacity, because kwangoku semncinci so akanabi nayo icapacity yokuba ngabana angazimela. Uzawumela kumzali, then ke ngoku umzali adibana namagqwetha so that ikwazeke nokuba ngabana ngeyiphi i-route ethathwayo state okanye private, so that if si-state ikwazeke nokuba ngabana ii-processes ezifanelekileyo such as i-notice of intention to institute proceeding against the state, ekufuneke ibe if i-claim it's against the state ifakwe within 6 months from the date of cause of action. So ezo nto funeke zilandelelwe ke ngokwendlela ekufaneleke zilandeleke ngayo.
Yeah, what you're saying, I guess,
So
it also
amalungelo akhe
answers
ke-
the question. Kuthi ke nangabe ngifuna ngisuwa the state or the individual doctor or nurse or medical practitioner concerned. Thank you so much for raising that point for us. Let's take our next caller. Sinasiphokazi ulapha ke emakhanda sakumele ehleleni sawubona.
Hello, good.
Kunjani mama?
Ngiyaphila bhuti wami, kunjani?
Siyaphila khulu. Khuluma nathi mama. What's on your mind?
Bhuti wami nami bengicela uncedo because I'm one of the people aba-experience i-negligence. Umke i-recent yenzeke ngo-August 2022. Ngingene esibhedlele ngingumuntu oyobeleka. Explainelwa ke by the paramedics ba i-labor yomntana izawuzama ureverswa. But ndiye nda-admithwa yi-casualty. Ndifike around about 9. But ugqirha uyofika kum kwabo 11 oko ndihleli ndilinde ugqirha ndimcenga into yoba ndifila intloko yomntana. Then ke wavuma ke into yoba mandithathwe ngosikazi intloko yomntana ndisiwe kwi-labor ward because ndizawubeleka as soon as possible. Instead of uba ndisiwe kwi-labor ward ndisiwe e-surgical. And then ke e-surgical they refused ukundinceda ndiba-explainele into yoba ndisewadini erongo, I need to give birth as soon as possible. Bathi no, mandiye kucreator idrama, mandilale, I will only be attended by ugqirha kusasa. So basically ndiphele ndizibelekela.
Njani sisi manje isikhathi asinaso unfortunately. How did the birth go?
Uswelekile umntana.
Nkosi yami.
Uswelekile umntana khanga bengekho equipment yokumnceda phayana because ndinikezele i-birth e-surgical. And then by the time ndisiwa e-labor ward nalapho i-nurses they refused ukumyoyisha because abanye bathi i-birth yenzeke e-surgical so they're not going to help.
So umfana ushone after giving birth noma it was a stillbirth?
No, uphilile umntana for an hour, 2 hours but wasweleka.
Okay. Siphokazi siyabonga kakhulu. Siyabonga kakhulu ke kusishayela ke, you'll have medical and legal advice nekuthi ke yini lokumele ukwende. Thank you so much and my condolences for your loss. Thank you so much for your call and for having the strength to call us and share your story with us. Siyabonga kakhulu. Asathathe ke ikhetho lethu lekugcina ke bekunene sitawuphindza sibuye emva kaloko. Welcome to a very final segment. Our session university. Unfortunately, our call lines are closed, and we'll just round up this conversation. Now, Mtlomelo, we had a very, very heartbreaking caller rather, from Spogazi ulapha emakhanda. Uthi yena she gave birth and nagaya ke esibhedlela bamsusa ku labor ward bamixa e-surgical ward. Nakathi uzama ke complainer lokuthi no bamfaka ewadini wrong, she was not listened to, and then an hour later the child passed away. Nokuthi ke what does she do in this particular instance? Nokuthi ke angayiprova kanjani i-negligence? Generally speaking nje i-negligence we prove kanjani against medical practitioners or a state institution?
Well, i-negligence uyiprova ngolu hlobo mhlekazi. But mandiqale ngokuba ndicacise uba yintoni nathi yenza. Since le nto yenzeke recently, so angakwazi uba approach amagqwetha so that akwazi umnceda am-advise as soon as possible. But i-negligence uyiprova ngohlobo lokuba ngabana uthi wofumana i-clinical notes ufumane ne-expect report ethi ichaze kakuhle umonzakalo lo wenzeke njani ngendlela le i-patient ibiphatheke ngakhona leading up to ukuzalwa komntana nokusweleka kwakhe.
Okay.
Iye ichaze ke le expect nokuba ngabana ingabe le ndlela i-client le okanye usisi bephetheke ngayo nenkonzo zempilo azinikeziweyo ingabe zikumgangatho ofanelekileyo na, ingabe mhlambi ukuba mhlambi omnye ugqirha benze ngendlela ethile ugqirha osengqondweni ebenothi yena uclient lo abe umntana wakhe uyaphila nangoku. So baye benze ke ngoku lo report esichazele ke thina njengamagqwetha nokuba ngabana
okay, Mr. Mtlomelo, unfortunately
siyakwazi basi
we are out of time, unfortunately. I was just University, but thank you so much for joining us. And Dr. Coetzee, many thanks to you for sharing your valuable insights with us. We do appreciate your time. Thank you so much for joining us. Kwanyalo ke mbukeli sasifike emaphathelweni nehlelo lethu namhla, and ngidawuthanza ke kubonga ke nonke nebekunene ngekuhlanganyela nathi kuze kube manje. Ngiphinde ngibonge letvakashi lethu ngesikhathi statho. Ngithanza ke kubonga. Please do join us again next week for yet another consumer affairs discussion. From me, Simphiwe Ncongwane, niseke nihlale kahle.